What is this? Brain, kidney. Okay. Brain. So what is this part of the brain called as? Frontal lobe. Then this one, occipital lobe. Then this entire temporal lobe. In between these two, I will see something. What is that? Insula. Insula. And what is this? Cerebellum. What is this? This particular part? Midbrain. Is it midbrain?
Oh, that's a pond.
See properly. Don't judge immediately. Which one? This is a
That's a pond.
pons. How is it medulla? This is pons.
This is in front of the cerebellum.
Medulla is this. Medulla is this. This is pons. Okay. This is pons. See that later. First listen. She didn't finish this and she's running there. Okay. She's so much excited to see the reproductive system only, not neuro. She don't want to see neuro.
I've seen this all before.
Oh, see, our interest is only in reproductive system. Okay. This is the pons, and this is medulla. Okay. What is this? This one.
So that's the gland.
Pituitary gland. This is the pituitary gland. Yes. How easily you can identify is immediately in front of it. What is there? Optic chiasma. So immediately behind the optic chiasma is the pituitary gland. So this is the pituitary gland and this is the optic chiasma. Now look at this orientation. Now you can identify, I guess. Thalamus, hypothalamus, pituitary gland,
Optic
optic
chiasma.
chiasma. So we repeat again. What is this?
Corpus callosum.
And what is this part, Aryan? What is this part? Anterior part. What is that anterior part? I said knee, bend, genu, and then body. This one, I told you the spelling also. I spelled it.
Splenium?
This is the splenium. And Armin, what is this? Spleniac. Spleniac. Splenium. Good. At least you are correlating it. Okay. This is splenium.
Yeah.
So you will forget after 1 week.
No, I remember.
Okay. This one? Fornix. This one? Is it okay?
Yes.
This pink and blue.
Pineal?
That is
That's all.
That produces the CSF. What is that?
corny, tuber, trap.
Nice
Second
memory
four
power.
options.
No option. Only answer. What is this? It secretes the CSF. So what
Is it pineal gland?
Pineal gland secretes CSF. Maybe in your
Corny,
body.
There's a name for it.
corny or cornic,
Starts with a T.
tibia,
Tibia, femur.
Tuberculosum.
Little star.
Second four options. I'm telling you, wait.
Starts with T and one more word is C.
Yeah,
TC.
Is it
TNC.
tuberculosum?
No.
Tuberculosum?
Two words. It's two words.
Tenus cordae.
Closer. Tila? Tila choroidea. Oh my god, so many hints I have to give. I wonder instead of MCQs, if I give fill in the blanks, what will happen to you?
We'll all die.
You'll see us next semester.
You'll see us next semester.
Only MCQs. Only MCQs. We don't know
Tila choroidea. This is the tila choroidea.
everything for us.
And this one is thalamus, hypothalamus,
Optic
optic chiasma, pituitary gland. This one,
That's third.
That's the ventricle.
Oh, the foramen Monroe. No.
Aqueduct of Sylvia.
aqueduct of Sylvius. Aqueduct of Sylvius. So this is which part of the brain? Midbrain. This is the midbrain. Aqueduct of Sylvius. Then it is passing into the fourth ventricle. From the fourth ventricle, it goes to central canal of the spinal cord. The other possible way is it can exit out here through this opening. What is this opening? Foramen of Magendie. Then here, this is what? What is this?
That's the
Septum pellucidum. Very good. Once I remove the septum pellucidum inside the lateral ventricle, from the lateral ventricle fluid, the CSF will come to the third ventricle through
foramen of Monroe.
foramen of Monroe. Foramen of Monroe. Okay. So this is all there, and pineal gland will be here. Can you see the tila choroidea? And the tila choroidea is protruding backward, right? That bulging. This bulging.
Yeah,
Okay. That is the pineal gland. Okay. This bulging is the pineal gland. So they say the third ventricle is protruded backward. They say, right? In PowerPoint it was there. So that is the pineal gland. Okay. Then anything else in this? Nothing. Now, okay, this is also over. So we have finished thymus. Because thymus I don't have anything to show. Thyroid gland we have finished. Pituitary gland we have finished. What is the other one? Pancreas. So we go to the pancreas. So here, so which way I should keep? If you keep like this is the actual anatomical orientation. Stomach, the stomach is here. Stomach continues as the duodenum. The stomach will be continuing with the duodenum. The duodenum is having 4 parts. First part, second part, third part, and fourth part, ascending part. So horizontal part, vertical part, again horizontal, again ascending part. The fourth part is called as the ascending part, which is broken here. Broken means they didn't show in this border. Okay. So this is called as the C-shaped concavity of the duodenum. The duodenum is C-shaped. The second part of the duodenum particularly. The second part of the duodenum is C-shaped. Pay attention. I can ask in the exam like this also. The second part of the duodenum, or which part of the duodenum holds the or consists of the or gives accommodation to the pancreas, I can ask. C-shaped which part? Second part. The second part of the duodenum. Second part of the duodenum is C-shaped. So from the C-shaped part of the second part of the duodenum, the pancreas is extending horizontally, and they are approaching towards the splenium of the hilum, not splenium. Hilum of the spleen. Hilum of the spleen. This is the spleen. This structure is the spleen, and here is the hilum. Like how you see in the lung, the hilum is the gateway, entry and exit of some structures. So this is the hilum of the spleen. So the tail of the pancreas is attached to the hilum of the spleen through one ligament. I didn't tell this in the theory class, but now I am saying it. There is a ligament, because if I tell that time, you will be totally confused. So there is a ligament. It is not just like that located here. There is a ligament covering like this, like my hand is covering this, right? There is a ligament holding the or covering the, like a ring, okay, covering or holding the tail of the pancreas. What is this? Spleen. And this is pancreas. So it is called as the spleno-pancreatic ligament. Very good. Spleno-pancreatic ligament. And one more ligament is connecting the spleen with the kidney, so that the pancreas is suspended there, so that when you jump, run, jog, it won't fall down. So there is a ligament like this connecting the spleen to the kidney and supports the pancreas. That is, instead of splenorenal, it is lenorenal. Leno, L-E-I-N-O. L-E-I-N-O, leno-renal ligament. It's not spleno. It is given short form maybe, the leno-renal ligament. Leno-renal ligament. L-E-I-N-O. I-N-O. Leno. L-E-I-N-O. What is it? Yes.
And then renal.
Renal. Kidney is renal, so it is called as the leno-renal ligament. This is
having another name, Leno? Is Leno a word that's
spleen.
related?
Yes.
So it connects the spleen to the
Kidney, so that it supports the pancreas. And then, so now let's talk about the pancreas. You know, pancreas is a mixture of endocrine and exocrine glands. It consists of both endocrine and exocrine part. So this is the head of the pancreas. This is the neck of the pancreas. See, behind the neck there are the vessels emerging out, and this entire structure is the body of the pancreas. And here is the tail of the pancreas. Okay. I don't know what is this bulging they are trying to show here in this
Maybe
model.
they're showing that there's something messed up.
Maybe pathological. They are saying this is a disease for bulging.
Gallbladder is kind of
Yes. Gallbladder should not be here. No, gallbladder should not be here. It should be down close to the liver. Maybe this is pathology model. So don't get confused with that. Just if you know this is pancreas, I'm happy. Instead of saying this as pancreas, if you identify this as the pancreas, okay.
So could that be a cancer?
Yes, possible. Pancreatic tumor can be there, or anything. And these are the pancreatic ducts, what you see here. And in detail, I don't want to go now. Maybe in the GIT we can see. The pancreatic ducts are again 2 parts: accessory pancreatic duct, main pancreatic duct. They bring the secretion, whatever you eat after digestion, all those bile. You heard about the bile juice. So the bile juice is the fatty meal immediately, like how you check the glycemic index of a sugar, they check the bile or the cholesterol level immediately after food. What happens when they pass through the duodenum, they get digested and they excreted, the fatty particles will get excreted as the bile juice. So from the second part of the duodenum, we can see openings over here. So through this, it goes into the pancreas through the duct, pancreatic duct, or from above, from the liver, it is entering here. So both the mechanism is happening that we'll see in detail later. So just remember this is the head, neck of the pancreas, then body of the pancreas, tail of the pancreas. Okay, that's it. Yeah. Any confusion in identifying? You see the vessels just directly in front of the vessel. They are the neck is a small portion, a narrow part. Body is quite big. Okay, and even head has one part. If you see the head, can you see the head is protruding downward? A small portion of the head alone is protruding downward here, like a tip projection. The small portion that is called as the uncinate process of the pancreas. UNCINATE. CINATE. NATE. Uncinate. Uncinate process of the pancreas.
How does bile reflex?
That is again, they should enter into the second part of the duodenum. If instead of that, if food particles are not passing into the small intestine beyond the duodenum, if food particles are regurgitated back, they receive the bile. Again, it causes contraction of the duodenum, and the bile is again secreted into this. That causes the reflux. Okay. What will be the color of the bile juice? Green color. That's why this is also green. Okay. That's why immediately during embalming, the person who died, immediately if you go and check, his entire abdomen will be green color. Not entire abdomen, at least that area where the pancreas.
Why your vomit can be greenish color.
Emetin. Yeah, greenish color. It won't be pure green, but yeah, mixed. Yeah. So since I have talked about the stomach today, I just want to show you this. You know, this is the esophagus, and the esophagus is now continuing into the stomach. So stomach, if you see, it has the part, like this is the cardiac end of the stomach because it's close to the heart, and this is the part where there won't be any food. This part of the stomach consists of only air. Gas will be filled with this. Normally there should be 30 ml of air. Okay, so what happens is, you heard about the heart burn. So the heart burn is not burning from the heart, it's acidity because of the cardiac end of the stomach. If this cardiac end of the stomach is ulcerated, okay, that causes the heart burn. So it should be filled with air. If you eat too much, the air gets replaced by the food. That is making you uncomfortable, like chest pain, all this. Okay, so this is the rugae. The stomach, if you see the elevations and depressions you are seeing, right, they are nothing but the muscles. The smooth muscles, they are folded here, called as the rugae of the stomach. These are called as the rugae, R-U-G-A-E. And this sharp groove, can you see over here? This groove? There is a groove here, if you notice properly. This area. This area.
That's the one that you said was
That is the canal of Magen-Stressing. So if you eat solid food, food will get stored here. But the liquid always will pass through this groove. So that is what I was telling. Any alcohol or any aerated drinks, what you drink, will, since they have more acidic content, they damage this area while passing through them. This part. Canal of Magen-Stressing, M-A-G-E-N.
why when some people consume alcohol, if they feel like chest pain.
Chest pain.
And then when
the
they
burning
eat something,
sensation.
then
Cool
it
down.
doesn't.
Banana or any buttermilk, if you have immediately. Banana they love, immediately after alcohol who will drink buttermilk. But sometimes they take banana and apple as a side dish.
Yeah.
This one. Okay? Canal of Magen-Stressing, this particular part. Alright? Yeah. Okay, so then it passed to the duodenum. Here is the duodenum beginning. Yeah. If again, the stomach ulcer, so many different varieties are there. Peptic ulcer, gastric ulcer. So if it is happening at the part of the stomach closer to the duodenum, then it is peptic ulcer. You heard about pepsinogen, the enzyme which again reacts there to cool down the ulceration. This we'll see in detail in GAT. Then anything else? So we have seen the pancreas, we have seen the thyroid gland, pituitary gland, pineal gland. What else? Huh? Adrenal. Where is the adrenal gland located?
Above the kidney.
At the superior pole of the kidney.
There might be here. Does she have her kidneys?
Oh yeah, but I don't know about this side. It is here. There is a adrenal gland at the upper pole of the kidney. Here, this one. This is the adrenal gland at the upper pole of the kidney. I think last time itself in the kidney I have showed you as well. So in exam, if I keep, you will be able to identify that. Okay. So what is this structure?
Are you serious?
No, that's the
Uterus.
bladder.
Or the bladder?
Uterus or bladder?
Isn't
I can't tell.
It's a female or male?
Oh, well, if it's female.
It is the uterus. Bladder is still downward because we can see the fallopian tube. Yeah. Okay. This one. Okay. Okay. Let's not go into that. Then, what are the parts of the adrenal gland or suprarenal gland?
Cortex.
It has a not apex.
Cortex medulla.
Cortex medulla.
Okay.
Cortex medulla, and then medulla has
The neural cell.
neural cells. What are the secretions from the medulla? Epinephrine or epinephrine from the cortex. Cortex is again having 3 layers from outer to inner. First glucocorticoids, mineralocorticoids, adrenal hormones or androgens. But actually these 3 layers, whatever I am saying, they have names. The cortex itself is divided into 3 layers, I told you, right? Zona glomerulosa, zona fasciculata, zona reticularis. The 3 layers of the cortex. Already the suprarenal gland is divided into 2 parts. Outer cortex, inner medulla. The cortex is further having 3 layers. What are the 3 layers? Zona glomerulosa, zona fasciculata, zona reticularis. So I can ask question like, what is the secretion from the zona fasciculata? Hey, mineralocorticoids. Yes.
Glucose first, right?
Zona glomerulosa produces glucocorticoids. Zona fasciculata produces mineralocorticoids. Zona reticularis produces androgens. Okay, adrenal hormones. Okay, aldosterone, androgens. Okay, yes. Then okay, renal, suprarenal gland is over. Then anything else we missed out? Pineal gland, pituitary gland. Ovary and testis. Yeah, your mobile. Yes. So name the parts here. Since we have completed the renal system, you should be knowing the parts. What is this? Not bladder. Gallbladder? What bladder? Specify. Urinary bladder. Okay. Then what is this? Ureter? Nothing. Ureter? Nothing. What is this? Seminal vesicle. Then this one. And this one? Prostate. Okay, prostate. Testis. This one is testis. Scrotum. Scrotum. Testis. What is this?
Spermatic cord.
Spermatic cord. And this one is penis. This is the neck of the penis. This is the glans penis. And here is the external urethral orifice. External urethral orifice. This is the body of the penis, dorsum of the body of the penis, ventral surface of the body of the penis. And then what else is? And here, this one, particularly, you know, this is testis, but what is this one? Epididymis. This is the epididymis. Epididymis. Okay, epididymis. So testis produces what? Testosterone. And anything else? Any other hormones? Today's class we saw Leydig cells. Leydig cells. And then moving on to the female reproductive system. Thank you.
Oh, do you want this one? Sir?
So there's one.
Yeah, we'll finish this also. This orientation. Yeah, male only the orientation. Now this is which view? Which section is this?
Sagittal.
Sagittal section. Okay, sagittal section. So from anterior to posterior. Yeah, what is so funny here? What is happening, Narmin? Nothing, right? Then focus here. Okay, what is this? Body of the penis, dorsum of the penis, okay, glans penis. And here, this one is the testis. This one? Epididymis, very good. And this is the spermatic cord. I told you, right? The pampaniform plexus of veins.
Yeah.
So you can see so many veins here. Okay, then here is the anal orifice. What you should know is between the scrotum and the anal orifice, there will be one like a nodule you will see, like a lymph node. It's not lymph node. No. No. Here one structure will be there.
Through the anus is where you can feel the prostate.
Between the testis or scrotum and the anal canal, there is one structure externally itself. I discussed about this in the class. It is there in the male also and female also.
Vulvar structure, right?
Yeah, perineal body. Not pineal body, perineal body. Perineal body is playing a major role in female. I have the model, I'll show you that. So this perineum is providing attachment to 10 muscles It is small structure like a lymph-like structure, lymph node-like structure, but it receives the muscles. 10 muscles it gives attachment. Okay, so that is why. Okay, if I go to that, but yeah, can you please hold this? Yeah. See here. Here, this orientation, if you go, this is the vagina, and here will be the anal canal. So between the vagina and the anal canal, there will be the perineal body. Here will be the perineal body. Okay.
So in between the anal orifice
And the vaginal orifice. Same in male, we saw between the testis and the scrotum and the anal orifice. Here between the vagina and the anal orifice. Okay. Why I have to stress on that? The baby is delivered through vaginal orifice or anal orifice? You are sure about that? Okay.
into one.
Okay. So this what happens, this perineal body, sometimes I told what happens is they give oxytocin, all those are happening, contraction is happening, but still the person is finding difficulty in pushing the baby out. So what they do is they cut this, they tear this. Through the vagina they pass the scissor and then they cut the perineal body also. So that it is providing a space, large space for the fetus to come out or the baby to come out. That is called, yeah.
Sorry, this question. They cut all the way down to the anus.
They won't go till the anus,
So the
little bit.
perineal
They won't go till the anus, above the anus itself they stop. If they cut the anus, then that's all. Vagina and anal will combine together. What has to come through, liquid will come out through that and this will come out through. Okay. So here this cutting and that is called as a sacrotomy. Median sacrotomy or medial sacrotomy, they say median sacrotomy or medial. So after cutting that and after delivery, they have to suture it back clearly.
Oh,
After that, they have to suture it back very well. Make sure that you are suturing back. I gave example also.
You said that these muscles weaken. That's
Will
why
get
the
weaker.
pelvic
For
bones
muscle.
for-
Why it gets weaker? Why the herniation can happen? Because as I told you just now, the perineal body provides attachment to 10 muscles. 10 muscles. So see how strong it should be. If that is torn, then 10 muscles are losing the support. Then it causes the herniation of the urinary bladder, herniation of the uterus. The uterus will come and fall out. The urinary bladder will come and fall down. Yeah, so many complications can be there. Okay? So this is all about this. So let's finish this.
I thought it was giggles.
Yeah, okay.
It's Kegels exercise.
Christine, you come this side. You both should not stand together.
I searched it out.
Come this side.
I haven't heard this.
So I don't know what is happening between you both. Something is wrong today. So it's better don't stay together. Yeah.
Isn't Kegels exercise or Kegels?
Kegels. Kegels exercise.
What is this?
See?
That's like
I won't
same
do
question.
I told you to go and practice also. You didn't practice. I told you to share the
You
video in
asked
the
the
group. You
same
didn't share.
question too.
Yeah. I told you to share or not. I told them to share the video also. You didn't share. You are supposed to do it. Okay. You can also try. No, nothing wrong. Everybody, all of us can.
Yeah,
do
if
it.
I-
And it's must for females after delivery. I told you also. That will strengthen your pelvic floor muscles. Yeah, where is the pelvic? No model to show that. So what is here? What is this?
It's so hard to see.
Come on. Okay. Prostate. This is the prostate. This is the prostate. Yeah.
Oh yeah.
This is the prostate. Okay? Navinan is in his own world. He is imagining where is prostate. He is imagining his prostate. I told you to imagine from toe to skull morning, right? So imagining every part, bits and pieces. Okay, Navinan, come here, please. Yeah. So what is this?
Urinary bladder.
Urinary bladder. That's not my urinary bladder. That is the urinary bladder. Urinary bladder. Then this is the neck of the bladder, and the prostate is here. This is the median lobe of the prostate. You all know the uvula vesicae.
Yes.
And when the median lobe of the prostate is enlarged, it blocks the internal urethral orifice, and that condition is called as a benign prostatic hyperplasia or hypertrophy. Anything can be there. Hey, seriously, something wrong with you, man. Arvind, today, what's happening? Somebody disturbed you? Somebody disturbed your mental peace?
No, actually, not at all.
Okay. So is this the prostate? That is seminal vesicle. Yeah. This was reference here. They go and open as ejaculated duct. That we'll see in detail. Yeah. This one. Okay. That we'll see later in the reproductive system. It's not urgent now. Okay. Anything else? Ovary did I show? Yes. Moving on to the female reproductive system. Really? Is this last one? I don't know. What else we missed? So this is the, what is this? Uterus. This one is cervix of the uterus. This one vagina. And I always kept telling, right, anterior wall of the vagina, posterior wall of the vagina. So anterior wall has been removed from here, and this is the posterior wall. Okay. Then can you see this like peak-like structure? Something here is the opening, but on either side of the opening you are seeing some space there. That is called as the fornix of the vagina. Why I am telling all this is when you pass a forceps or something, forceps delivery. You heard about the forceps delivery? Sometimes the person, the clinician will try to damage. The forceps will go and stuck here, and they will be digging again and again to check whether check the direction, and they think that he is not approaching. This happens with the interns usually.
So do you
Pap smear also again. Pap smear is usually vagina. They will take from the uterus also. Yeah, that's what you should be guided properly. So in pap smear also you should approach the cervix of the uterus. Mainly in the cervix they take cervix of the uterus. And okay, this is all about the cervix of the uterus, and this is the internal os of the uterus. This is the external os of the uterus. Like how we have internal urethral orifice, external urethral orifice. In the uterus also we have internal os, external os. This is important in identifying the baby should reach till the internal os for certain months. So by seeing that only they will identify which month it is in, whether on proper month it has proper growth or not. If suppose on 6th month it has to reach the internal os, if it's not reaching there, then there is some emergency situation, you have to deal with that. Yeah, injection can be given, medicine. OS.
Oh, just OS.
OS, internal os, external os.
Is that just like the openings?
The openings. This one. And this is the fornix. In the vagina there is fornix. In the uterus there is os. Okay? That's it. Then now moving on to the endocrine gland. Among all this, which one is the endocrine gland here? Ovary. So this is the fallopian tube, and here is the ovary. This side, this is the ovary, and they are showing the follicles. And the white color indicates the corpus albicans. The yellow color indicates the luteum. The red color indicates the corpus hemerogicum. Okay, corpus hemerogicum. So this is the fallopian tube, the entire structure. This is the fimbria of the fallopian tube, which is helping in providing attachment to the ovum. From the ovary, the follicle ruptures and the ovum is released. That ovum is absorbed by the fimbria, and then because of the pressure or suction effect, the ovum is pushed inside or pulled inside the fallopian tube. This is called the infundibulum of the fallopian tube. This is the ampulla of the fallopian tube, and the narrow part is called as the isthmus of the fallopian tube. Finally, they are opening into the body of the
Could you
uterus.
show the ampoule again?
Ampulla is this bulged part.
That's where confusion.
This is fimbria of the fallopian tube, the finger-like structures, and this is the ampulla. This is infundibulum. This is the ampulla and isthmus. Isthmus is the narrow part. It should be still narrow. They are showing a little bit broader here, and this is the ovary.
So the ampulla is where the fusion happens.
Ampulla. It's not fusion. Fertilization. Fusion. Fertilization is fusion. Like I told you one example, when we ask end of fertilization, we can write pregnancy also, and if you are anatomically writing, you should write all the 3 or 4 processes. And this is the body of the uterus. So can you see something here? That is showing the implantation model actually. It's getting implanted here. But what I told you, it should be interior.
Drilled inside, yeah.
Yes.
And then over it, there's a layer of endometrium.
Yes, layer of endometrium will be covering it. And what is helping in drilling or penetration? Instead of saying drilling, since it was new to you, I said drilling, but the actual term is penetration. What is causing an enzyme again? Enzyme and protein, a polypeptide is helping in the penetration there. We'll see that later.
Also, it's not progesterone.
Not progesterone. Progesterone is helping in implantation, but
The
that
specific
penetration,
drill? Okay.
penetration is mainly.
What's the name?
It's propylene phenyl something. It will come. I'll check and tell you.
Oh, like
Okay, that's it. I think this one they are trying to show the abnormal implantation maybe, because it has to be implanted here. See, it is passing within the endometrium itself and coming here. Okay, ectopic pregnancy, and then eclampsia. So many things are there, because sometimes during delivery they get fits. That's because the fetus the attachment of the placenta. Fetus is developing here, and the placenta is also developing there. Placenta should be here, but instead of that, sometimes placenta will go and block the internal os. That's why I told you, named those parts, internal os, external os. Placenta will block here, that is called as the placenta previa. Placenta previa. So with a block here, then it will be difficult for the fetus or the implanted baby to reach till the external os.
So in that case, would they have to go for C-section?
First of all, the baby is not developed properly.
It's not developed.
Developed because of this placental wrong. I mean.